Hello everyone, I'm Nikita Kohli, back again to discuss the COVID-19 patterns and developments in India. Basing myself on the numbers collated by my team at MitKat's Information Services Division, I will be showing how, despite the continuing of some of the larger nationwide trends, the significant diversions at the micro level are showing a stretching of the curve in India. Looking first at the nationwide trends, we see that COVID 19 cases are now about 800,000. With this, India is now the country with the third largest number of infections in the world, behind only the US and Brazil. Despite the staggering number, less than 35% of these are active cases. The doubling rate also remains about 20 days, same as that of last week. The per week growth rate of COVID 19 infections in India also continues to decline. But despite these positive developments, we are seeing one major disturbing trend. That is, the per day new cases continue to rise. The last week has seen over 20,000 new cases per day, at, and that trend continues to grow. 9th July, in fact, marked more than 26,000 new cases per day and marked the single largest day increase. This is a trend and development that we need to keep continuous note of to get an accurate picture of the situation in India. Till the time the per day new cases keep rising, any other number or development such as the number of recoveries will not show the real picture. This is the main factor for looking at the infection rate. Looking next to the deaths due to COVID 19, we see that as of 10th July, there are just over 21,000 deaths due to COVID 19. This means that India has a case fatality rate of less than 3%, which is a very low rate compared to the other countries with a similar infection rate. Despite this number, we're seeing that there has been an increase in the additional deaths per day, with more than 400 additional deaths being marked every day for the past 1 week. In fact, 4th of July marked 620 additional deaths in India, and with this, despite the fact that the per week increase is declining, just the growth rate of the deaths in India is changing. That means that we are seeing more number of people dying from COVID-19, despite the fact that a lot of these are due to comorbidities. While we need to keep a lookout on this development, it's not going to be the main factor to look at the health of the nation. It is the other major nationwide trends which will show us the true picture. And this is where we see that India has once again marked its biggest per week increase in cases, with almost 150,000 additional cases being recorded in the week between 3rd and 10th of July. The number of recoveries is positively reaching about 500,000. And with this, we have over 60% recovery rate, which is really a positive number to look at. When we look at the testing rate, we see that India's again really enhanced its testing capacity, which is especially being noted by the number or the increase in the number of tests which are being done as per ICMR in the past 24 hours alone. Despite that, because of the change in different policies of testing strategies by different states, you're seeing a test positive rate of India reaching 7.18%. This is up from 5 and 6% that we have been seeing over the past many weeks. Despite the change in number, we are seeing that a lot many more people are getting tested. And of course, with a lot of the tests being done based on contact tracing, this test positivity rate will increase. At the same time, I believe that this is a much better number to have because at least you're getting to see more and more people being tested. And while it would be better if a lot of other states were able to do what Delhi is doing, that is, they're looking at all of the to test all of the people that they possibly can. Contact tracing testing numbers is also a positive trend to keep an accurate tab on all the people who may be getting infected. But since we are going to see an increase in numbers, we can clearly expect that in about 2 weeks' time, India will cross the 1 million case count. Despite that, despite the high number that is, we will also see an increase in recovery rate and a declining case fatality rate. This will be even more true since we're seeing more and more new ways of recovering, of treatments and everything else that is going on, especially with Maharashtra now starting plasma therapy. This will be a positive trend to look at. When you look at the macro level or the state level analysis, this is where we will actually be able to see which are the areas of concern and which are the areas which are doing better. When we look at the numbers, we see the top five states of Maharashtra, Tamil Nadu, Delhi, Gujarat, and Uttar Pradesh continue to contribute about 70% of all COVID-19 cases in India. So the reason that the number has declined from over 70 to just below 70 is that other states like Assam, Karnataka, Rajasthan, and West Bengal are now seeing an increase in the trends. When we look at metro cities or the major cities, we see that the nine cities are nine because we are now added Ahmedabad to the mix. So we have Delhi, Mumbai, Chennai, Pune, Hyderabad, Ahmedabad, Bengaluru, Kolkata, and Gurgaon. The nine cities together contribute to roughly 50% of all COVID-19 cases in India. When you look at this, of course, the main city that remains a big concern is Delhi because it has over 100,000 total COVID 19 cases and it's seeing 10, 12,000 additional cases every week. This means that we have, in the past 1 week between 3rd and 10th of July, the capital has seen 13.5% increase in cases. And while this is less compared to the 22% increase in the prior week, it means that the testing capacity is increasing as well as the recovery rate. So that means we have Delhi has a recovery rate of over 76% and a case fatality rate of about 3%. These are very positive numbers for Delhi, and as you can see from the graph on the screen, the case fatality rate is really low. The red line is almost negligible and the recovery rate is more than double of the people who currently have the infection in Delhi. Alongside that, Gurgaon presently has one of the best metrics among the metro cities. This is because it is sharing a lot of the testing capacity in healthcare facilities with Delhi and the lots of movement of patients across the border. And with this, we are seeing a high recovery rate of over 83% and a low case fatality rate of just about 1.5% in Gurgaon. Also, only about 15% of active cases are there in the city. Bengaluru, on the other hand, continues to have one of the worst trends. It has seen over 200% increase in the 10 days of July, with over 90% of these increase happening in the last week, that is between 3rd and 10th July. And it's also accounting for about half of all the cases in Karnataka, with 80% active cases and a recovery rate of only 20%. Bengaluru and increasingly Pune and Kolkata are seeing a lot more numbers than before. Pune and Hyderabad are now seeing more cases, and with the states not releasing the other numbers of the recovery rate and the additional deaths which are happening, especially for Hyderabad. And Pune also seeing an increase in cases with an increase in movement of people under unlock 2. We will continue to see these. And while we are now seeing an increase in the lockdown status and all of those new regulations coming in place, it may just be a bit too late. Despite that, we are not seeing any such development in Bengaluru, which is a massive case of concern for everyone in the country. Bengaluru has one of the highest case counts and the highest growth rates amongst the metro cities and needs to be looked at with particular care and caution, specifically for IT/IES companies who need to have people working from the office spaces since work from home is not always possible. But as we go along, it is now absolutely imperative for everyone to understand that it is not just possible to look at carbon measures as simply another measure after the SOPs. These are now the measures of the way of life or the SOPs which have to be integrated. You have to be wearing face masks, you have to be having social distancing measures and continuous sanitation measures based on alcohol based sanitizers. The only thing which is actually killing the virus at the moment. But as we go ahead, please continue to look back to us and ask us how MitKat can help you in bettering your workplace. Until next week, take care and goodbye.